Hey, we're live. It's Dr. David here from Paso Manual Physical Therapy. Welcome to our live stream. I'm going to just give everybody a moment to jump on. We'll just talk through a few things here, and then we're going to start answering questions for anybody that comes on. I have about 15 minutes today, and we'll be doing this about every week. I missed last week. I'm so sorry for those of you if you were expecting last week. We had to do a travel conference for the company, and I was hoping to do one while traveling, and it was just not going to work out with Wi-Fi connections and everything. So if any of you were waiting for one, I'm so sorry, but we'll get back to them, and hopefully we'll post a schedule that we can stick to regularly. At this time, I'm just too busy in the clinic with patients, and I cannot commit to a consistent time. Mondays work for the most part, so I'll be on Monday. Anyways, let's get to the question at hand. Let me pull up the exact comment here. I have it screenshotted so that I can read you. Here we go. Cheryl Griego asked, she commented, "Hi, Doc, really learning a lot by watching your videos. Question, I have bone on bone in my left knee. Because of the pain, I limp. My right hip hurts now. Could the way I limp be affecting my hip?" And the answer to this, Cheryl, is a resounding yes, absolutely. Any sort of limping can affect any joint that has to do with the legs, even the low back. It's just a matter of time before something becomes affected. Now, if you've got a bone on bone knee joint situation, what you wrote in the comment here is the left knee. So I'm going to show, let me tip my screen here a bit. If the left knee is bone on bone, that means likely that you have lost some motion. You can't maybe fully straighten out your leg. You're staying bent like this. And the other thing that's likely present is you've got a hip muscle imbalance. So the muscles in the front of the thigh here are likely overdeveloped or over dominant. They're working too hard. And on the back, in the butt area, these muscles tend to be weak. So if you're having pain now in that leg and you're limping every time you walk, like you're kind of doing this, then it's going to change the way that your hip muscles stabilize. And it's just a matter of time before you start to get pain in the hip. Now, there's tons of things that could cause pain in the hip. It might be the muscle imbalance itself. It could be nerves. It could be the joint. Real quick, I see many of you are online. Please type something in the chat to let me know that you can hear me, because I don't have any other feedback from you guys. Just type something and let me know that you're there. Anyways, if you are using your muscles inappropriately, then you're going to affect the hip joint. That's the most commonly affected joint. The next most commonly affected joint is going to be the ankle, and then the foot, and then the lower back is often affected as well. And it doesn't matter the side. In case you're wondering, well, it's my left knee. Shouldn't my left hip hurt? But because your legs work together for you to be able to walk, if you're limping, you're going to potentially influence the other side as well. There's no rhyme or reason to this. It doesn't always make sense. And we don't need to make sense out of it, really. I mean, you could split hairs and say, oh, well, using this muscle and the amount of time that you're spending on the other leg because of the way that you're limping is throwing it off. We can get into splitting all those hairs, and you probably could pinpoint it real hard. But the fact of the matter is, you just need to figure out the root problem, which is stop limping. And for that, for you, Cheryl, you might need to loosen up your knee joint. You might need to fix the muscle imbalance. You might just need to stay off the knee for a bit, or some combination of all of that stuff in order for you to flare down that knee joint enough for you to stop limping so that you can walk normally. Now, a big side note that, hey, Gary Arzamendi, thanks for checking in. I appreciate you, Gary. Now, a big side note in being able to walk normally is you have to avoid limping once you feel better. Now, Cheryl, you might think to yourself right now, if you're limping a lot, I can't stop limping right now. It's just hurting. Get off that leg. You need to calm down the irritation so that you can tolerate standing on it. And if you have to get around, get a walker, get a cane. I mean, you need to just get off the leg to preserve your cartilage so it's not wearing down faster and faster as time goes on. So do what you need to do to flare it down. Of course, you might take some pain medication right now if that's necessary to get through the day, but don't let it mask your pain so bad that you're still walking on it and irritating it. Get off your leg, reduce the amount of walking that you need to do for that bone on bone knee so that you can allow the inflammation to go down and better be able to tolerate putting weight through your knee as you get better. Gary, you got a question here. How do we build up our knee or strengthen it? Same, my left. I'll answer that in just a question. So once you can calm down your knee joint, now you're in a position where you can strengthen it. But before you go to strengthen it, you've got to make sure that you can walk normally. And using your glutes is a big deal, making sure that you turn your feet out a bit and walk a lot like what Charlie Chaplin, people say a Charlie Chaplin walk. And what I mean by that, let me just show you in case you've never seen this. You've got to stand. Most people stand with their feet kind of forward like this, maybe even in a bit. When you stand like this, you're going to be less likely to use your butt muscles. But if you turn your feet out, your butt muscles will work better. And there's a really cool way to test this out. Do me a favor. If you're watching this right now, stand up, turn your feet in. I'll show you on me. Turn your feet inwards, like all the way, as much as you can comfortably without hurting anything or losing your balance. And then try to squeeze your butt muscles up at your hips. And chances are that they'll work, but not very good. Then point your feet out and tighten up your butt muscles. And all of a sudden they work a lot better. And, with the whole test retest, there's a whole science behind it where like you can trick somebody into thinking that it's better the second time. Do this over again and over again. Your butt muscles will work better when your legs are turned out. So if you walk like this, then you automatically decrease the pressures inside your knee joint, which will allow you to tolerate being on your feet for longer after you flared down that knee joint, Cheryl. So now once you can tolerate walking so that you can do your everyday stuff, then the next step is to go into strengthening, what Gary's talking about here. There's tons of ways to strengthen. We've got tons of videos on our YouTube channel. We've got a library of videos of exercises that you can use to strengthen your knee. And if you've been on our channel for any length of time, you've heard me preaching about how important the glutes are. I just talked about it a second ago. The butt muscles are king in making sure that your knee joint is healthy over time. A lot of people in the healthcare field, I'm talking like physicians, doctors, physical therapists, chiropractors, virtually anybody that you'll talk to in the healthcare field, 95+%, I venture to even say 99% of them, if you have a knee injury and you ask them for advice, they're going to tell you, strengthen your quads, the front of your thighs. And logically, it makes sense because if your knee hurts right here, this muscle is the most visible muscle if you look down, and it's easy to fire it because it's out of balance. It fires already. And so strengthening it might make sense to some people. But what a lot of people find out is it hurts them to strengthen it. Sometimes immediately, sometimes not. Sometimes after the fact, like, the next day or after a few weeks of doing it, their knee pain gets worse. It's usually because of this whole muscle imbalance concept. So what you've got to focus on, Gary, is strengthening the butt muscles, because we've got this really cool reflex built into the nerves of our body. It's called reciprocal inhibition. Now, you don't have to memorize that, but what you need to know is that it's a reflex that causes the over-dominant muscle to shut off. And in your hip and thigh, it works with the glutes. So your thigh muscles on the front, if your quads are over-dominant, they're causing that pain in the knee, you can get these muscles to shut off most of the time if you can fire better back in here. If you can get the glute muscle to tighten up more, then it sets up your quad to calm down. And if you can do this on a regular basis, like every time you go walking or exercising, then you're in a much better position to calm down your quads, which calms down the pressure, reduces the pressure inside the knee joint. And if you've got a bone-on-bone knee joint situation, it is critical that you take the pressure off so that you can alleviate the pressure at that site where the cartilage is worn down and the bone might be a little bit exposed. I hope that answers your question, Gary. And I definitely am looking at answering a Cheryl's question as well. All right, I've got another comment here from Jazzy Spirit. Hi, Jazzy Spirit. She says, hi, happy face. Can osteoarthritis/meniscus of the knees cause aching thigh muscles with occasional thigh spasm? Not pain, but ache. Thank you. Absolutely. Yes, a resounding yes, Jazzy Spirit. Osteoarthritis and meniscus problems in the knee are usually set up by this same muscle imbalance that I'm talking about, where your quads are too strong, and then it's causing a lot of pressure at the knee joint. So that's what wears down the knee joint. That's what irritates the lining of the knee joint, which is osteoarthritis, and can injure the meniscus in there, which is a big chunk of cartilage, or it's a cushiony tissue inside the knee joint to protect the bones from hurting each other. If your quad muscles on the front of your thigh have been working too much, they can ache. The muscle itself can ache. And there's also a bunch of nerves inside the thigh muscle. There's the main branches that go through there are the femoral nerve. You have some branches that branch off of that called the saphenous nerve that run down the inner part of the knee. But the main one is the femoral nerve, and you can cause a nerve irritation. Of course, the muscle itself might be the source of irritation, and the tendon where the quad muscle attaches to the kneecap at the front, that can also get kind of achy for people. So if you have that achiness, what I would look to do is calm down that thigh muscle. You might massage it. I mean, you might with your hand just get in there and massage the tender spots. You can use two hands. There's all kinds of things you can use. I've got a tennis ball right here. You can use a ball just to rub it out and massage it. Now, this isn't going to solve the root problem. It's not going to make this muscle weaker and make your glutes stronger. You still have to strengthen. There's no substitute for strengthening. I mean, I wish we had a magic pill that would make you stronger without having to work through the reps. But if you just free up this muscle, it calms it down so it doesn't want to fire as much, and it takes pressure off the knee joint. And doing this for a few minutes is all you need. And you find those spots in the muscle, Jazzy Spirit, where it's like harder or more tender, and you just rub that one spot for like a minute or so, it tends to calm things down. And you can be very aggressive with this. And if it is truly a nerve problem, you'll start getting pain that shoots up your thigh towards your hip or down your thigh towards your knee and lower leg. You don't want to rub on it with a tool like this. You need to make sure that you are easing off of it. But if it does give you some relief, then it's definitely a good thing for you. And something else that you might use, I've actually got it right here, is a percussion massage gun. A percussion massage gun. So I've got this one that we have had for a little while. I'll drop a link to buy one of these if you want to get one. We have these. We got this off Amazon, and it comes with all these different heads. I like just the standard foam ball head. Let me attach it, and I'll show you how to use it. Just pop that on. Switch it on right here. It's at 80% charge. Let me turn it on. I like to start at somewhere between 5 and 10. I'll put it on 10. And Jazzy Spirit, this does wonders for aches on your thigh. If you just work up and down the thigh, just like so, and find the spots that are more stiff, and just hang out there. You can do little circles. You can go up and down, like towards your knee and hip. You can go sideways and just work it out for a minute or two. That will allow your thigh to calm down. You can do all this stuff and get it calmed down, and you have to exercise though in order to get the muscle to keep from becoming achy for the long term, and to take away the pressure that builds up at the knee, because that's the ultimate thing to reduce the pressure on the meniscus and the cartilage inside your knee. I hope that helps, Jazzy Spirit. Let me know if I answered your question, or there's something else that you wanted to ask that I might have missed. And for those of you watching, we've got just less than a minute left. So drop a question. If not, I'm going to get going here. I gotta get rolling. And if you're watching this on the replay, still comment and drop a question here. We're happy to get back to you as soon as we get a chance. All right, going once, going twice. We're going to wrap this up. Thank you, everybody, for coming on live. I really appreciate you dropping the questions. We'll look at doing this next week, and I'll try to get a message out on the community tab on our YouTube channel as fast as we can. So subscribe to our channel so that you can get our community tab updates, so you can get notified whenever we're going to come on live. and I'll try to do as a more advanced time as best as I can. But it just depends on my schedule. Thanks so much, everybody, for joining us. We'll see you in the next video. Bye-bye.